I appreciate the opportunity to present a brief update on behalf of the clinical core. So the core of the clinical core team is John Bartlett, who I'm sure you all know, Stuart Carr, who's in the upper right-hand corner of the picture, Kathy Link, who's in the bottom left-hand corner of the picture, and then I'm on the right, working in my home office. So it's lots of Zoom meetings. These are really the people that perform the bulk of the work of the core. I just also want to mention Susanna Nagy, who runs the biorepository, which is also a key component of the core. So there's a lot of efforts ongoing currently, and can't possibly go into all of them, but I really want to call out Kathy Link and Stuart Carr for the regulatory support that they are providing both locally and internationally. So right now they're providing regulatory support for over 70 HIV-related studies, in addition to other types of studies that they do. So those services are being provided to a multitude of investigators at all levels. In addition, Stuart is providing study coordinator support and recruitment for 8 studies. And he will go to the clinic and he will recruit individuals. He's also now, with COVID, doing online Zoom and online consenting of patients for studies. John Bartlett and I are currently mentoring a combined total of 8 faculty that have a focus on HIV. And those faculty have a number of successful grant applications, and John and I have helped them plan their grants, review their grant applications, and consult on their clinical study designs. In addition, John facilitates interactions between the Duke CFAR investigators and partners at KCMC, and I also work with the pediatricians at KCMC to help facilitate those interactions. John serves as the program director for the Socio-Behavioral Sciences in HIV Infection Research Training Award, which is also an important award. And then Susanna Nagy and the Duke HIV Database and Biorepository are providing information and samples to researchers as they're requested. Overall, services that we will provide to any Duke CFAR investigators is we will work to provide regulatory support for your studies. Certainly if you have grant-funded studies, support is helpful, but we certainly will help you to the extent possible without charging if you don't have the funding for it. Study coordinator support, including recruitment, and that's primarily Stuart. John and I, as well as Stuart, can provide consultation on study design, implementation, what's feasible, what clinic populations do we have access to, what kind of works in clinic, what might work for individual volunteers to sign up. John and I will provide clinical research mentoring. And as I said, we do that for a number of faculty and trainees right now, and we're always open to additional needs. We will provide grant consultation and grant review as requested. We do have outreach activities extending outside of the Duke to clinics in Henderson and Fayetteville. And then certainly biorepository access, both the Duke biorepository, but also we can facilitate access to other networks. So ACTG, Impact, there's a number of other networks that have extensive biorepositories that requires a bit of networking to get access to, but we can help you go through those steps. So our contact information, John is the director, his email's there. My contact information, Stuart, Catherine, and then Julia is a clinical outreach coordinator. She primarily works with the CAB, so if you have questions about or want access to the Community Advisory Board, Julia is the person to get in touch with.